to the channel. Please like, share, and subscribe. This article comes to you from verywellmind.com. Circadian Rhythm Sleep Disorder. Your circadian rhythm is a daily cycle of mental, physical, and behavioral processes in your body, also known as your body clock. It governs bodily processes such as sleep, heart rate, blood pressure, body temperature, digestion, and hormone production, among others. Each circadian rhythm cycle lasts anywhere between 23.5 to 24.5 hours, or approximately the length of one day. This is because the circadian rhythm is largely turned into the presence of light. Side note, we are essentially programmed to sleep at night while it's dark and eat, work, and be active during the day when it's light outside. Disruptions to this programming can lead to circadian rhythm sleep disorders. Types of circadian rhythm disorders. These are some of the types of circadian rhythm disorders. Shift work disorder. Shift work disorder affects people who work night shifts or alternating shifts, as irregular timings tend to clash with the body's natural circadian rhythm. This condition can affect your body or your ability to sleep well during the day. It can also make it hard for you to stay awake during your night shift. Delayed sleep-wake phase disorder, DSWPD, one of the most common circadian rhythm disorders. This condition can cause you to sleep later than most people and have difficulty waking up in the morning. It can make it hard for you to function at school or work and leave you feeling tired and irritable during the day. Next, advanced sleep-wake phase disorder, ASWPD. This condition can make it hard for you to stay awake in the evening and cause you to wake up very early in the morning. It can affect your work, school, and social activities. Irregular sleep-wake rhythm disorder, ISWRD. Instead of an uninterrupted night's sleep, irregular sleep-wake rhythm disorder can cause you to experience several short periods of sleep and wakefulness. You may not feel rested during the day and have to take several naps due to excessive sleepiness. Non-24-hour sleep-wake rhythm disorder. This condition occurs when your circadian rhythm is not in tune with the 24-hour day. It typically affects people who are blind and have limited exposure to light. It can cause your sleep timings to gradually become more delayed, to the point where you go to sleep at noon instead of at night. And finally, jet lag disorder. Jet lag is a temporary sleep disorder you may experience if you travel rapidly across multiple time zones due to the time difference. It can take your body a few days or weeks to adjust to the timings of your new location. In the meantime, you might find yourself awake or asleep at odd hours of the day. Symptoms of circadian rhythm sleep disorders. The symptoms you experience can vary depending on the type of circadian rhythm sleep disorder you have and may include difficulty staying awake when you need to be active, difficulty falling asleep when you go to bed, daytime sleepiness, tiredness and exhaustion, lethargy, headaches and other pains, upset stomach. The symptoms of circadian rhythm sleep disorder, such as exhaustion and sleepiness, can put you at an increased risk of car crashes and workplace accidents. Mental health impact of sleep disorders. Circadian rhythm sleep disorders can also affect your mental health and cause you to experience symptoms such as difficulty concentrating, lack of alertness, impaired learning and memory, poor judgment and risky behaviors, difficulty regulating moods, poor personal relationships. In addition to these symptoms, circadian rhythm sleep disorders are associated with several mental health conditions, including major depressive disorder, bipolar disorder, post-traumatic stress disorder, generalized anxiety, schizophrenia. Causes of circadian rhythm sleep disorders. These are some of the factors that can contribute to the development of circadian rhythm sleep disorders. For starters, your age. Your circadian rhythms can fluctuate with age. For instance, teenagers tend to have a later bedtime than most people and have an increased risk of delayed sleep-wake phase disorder. Similarly, older adults tend to sleep and wake up earlier than most people, putting them at risk for advanced sleep-wake phase disorder. Older adults are also at greater risk of experiencing jet lag and shift work disorder. Next, gender. Men or people who were assigned male at birth are at greater risk of developing advanced sleep-wake phase disorder. Women or people who were assigned female at birth are at greater risk of developing circadian rhythm sleep disorders during pregnancy, menopause, or the postpartum period. Next, occupation. People who work in fields such as medicine and security and have shifts outside the traditional 9 a.m. to 5 p.m. workday may be at greater risk of developing shift work disorder. Jet lag disorder is more common among pilots, flight attendants, and people who travel often for business. Next, genetics. Inheriting variations in genes that control your circadian rhythm, known as circadian clock genes, can raise your risk of developing circadian rhythm disorders. Next, medical conditions. Medical conditions such as Parkinson's disease, Alzheimer's disease, Huntington's disease, Angelman syndrome, autism, blindness, stroke, and brain tumors are linked to an increased risk of circadian rhythm sleep disorders. Next, mental health conditions. There is a bi-directional relationship between sleep disorders and mental health conditions such as depression, anxiety, bipolar disorder, and schizophrenia. And finally, substance use. Chronically using caffeine, alcohol, nicotine, or illegal drugs can raise your risk of circadian rhythm sleep disorders. Diagnosing circadian rhythm sleep disorders. Your healthcare provider may refer you to a sleep specialist for diagnosis and treatment of a circadian rhythm sleep disorder. Diagnosing a circadian rhythm sleep disorder may involve the following steps. Medical history. Your healthcare provider will inquire about your personal and family medical history. Clinical interview. Your healthcare provider may ask you what symptoms you're experiencing and how long you've had them. They may also inquire about your work, lifestyle, and use of substances. Physical exam. Your healthcare provider may perform a physical exam to help rule out other potential causes of your symptoms, such as sleep apnea, heart disease, lung conditions, or chronic pain. Actigraphy. Your healthcare provider may ask you to wear a small motion sensor for a few days or weeks to measure your sleep-wake cycles. Sleep study. Your healthcare provider may recommend a sleep study to monitor your breathing, heart rate, brain waves, oxygen levels, eye and leg movements, and other parameters while you're sleeping. Other tests. Your doctor may also perform other tests to check your natural sleep rhythms, your body temperature, and the levels of hormones like melatonin and cortisol in your saliva. The article also suggests that you keep a sleep diary. Maintaining a sleep diary can help you track patterns in your sleeping habits and symptoms, so you can report them to your healthcare provider. You could record factors such as sleep time, wake time, duration of sleep, quality of sleep, symptoms experienced. As for the treatment options, please refer to the article. That's it for this article. Thanks for watching and have a great day.